Eyes have been perhaps one of the greatest sources of dad jokes, comics, and memes that get cornier and cornier. Let's react to some. When you forget your glasses, but you remember the pinhole effect. Oh, this is actually true and kind of cool. So the pinhole effect is basically what we do when we squint our eyes to see clearer. What you're doing in that case is you're eliminating peripheral rays of light from going in and causing the blur. Only the central rays get through, and those land directly on the retina. So there's not any out of focus rays around that makes the image blurry. So if you forgot your glasses, squinting can help to improve it, but it's gonna be uncomfortable after a while. Actually, my biggest fear about the apocalypse is probably just losing my glasses. That's true, that would be really scary for people with blurry vision. Would 100% immediately give up? Forage for food? I can't even tell the diff between an edible berry and a literal rock. True, you would really need your eyes if you didn't have somebody with you and you had blurry vision. If you were nearsighted, you could look up close, but if you were farsighted, you would not be able to tell. I have thought about this in detail. If there's an apocalypse, this would be my priority leaving work. Oh, and he got his tray of glasses. Okay, this is cool, yeah. So I think all optometry students get this sort of tray of glasses in a huge suitcase, and we use it throughout school, throughout our training, and then take it with us to use. We don't use it often, but it can be used to put these little lenses in these glasses that look kind of like a torture device, more or less. But you put the glasses in and you can make your own pair of glasses depending on what your visual needs are. It's a way that can help us verify prescriptions and do other things. So having that would be perfect. So if there's an apocalypse, go find your nearest optometrist or ophthalmologist and break in and steal their tray and figure out what's gonna work if you need it to survive. Do you ever take your glasses off at night and think, dang, natural selection would have taken me a long time ago if it weren't for the development of optometry? Yeah, so that definitely goes along with the other one. Having glasses has been a major improvement, and then the invention of bifocals too. I mean, people later in life are way more functional than they ever used to be, and you're welcome. Deep dark fears. Sometimes I get an eyelash in my eye, and when I blink, it's gone. I worry there's a space in my head behind my eye full of eyelashes. Ew, okay, that's really disturbing looking. That's not true at all. So the eye is like a totally enclosed space. We have, covering the white part of your eye is the conjunctiva. It's a really thin layer of tissue and it's clear. And this tissue actually goes underneath the eyeball and then loops around and lines the inside of your eyelids. So it is a totally closed space. You could get an eyelash stuck up in there, but it's pretty easy to look inside there just by lowering your lower lid. And then the upper lid's a little harder. You might need to flip it inside out. And then sometimes it may take a professional to remove something that's kind of lodged way deep in there. But you know, nothing's gonna be stuck there for a long period of time, although we've all seen those stories of people finding many years worth of contacts back there. But if you lose something behind your eye and you can't find it yourself, you feel like it might still be there, just call your eye doctor. We can usually find it pretty easily. Puns about the body are generally corny, but puns about the eyes are even cornier. Yeah, terrible, terrible dad jokes. You saw me and didn't even say hi. Oh, Squidward forgot his glasses. Yeah, that's a really good point. If you have an awkward moment, you shouldn't always assume that it's because of you or the other person. You know, maybe they just don't have their glasses. Maybe something else is going on. Maybe they just didn't see you. You know, hopefully that makes us all feel better the next time we have an awkward run-in with somebody. I guess I'm officially old. I just spent 10 minutes chasing an eye floater with a fly swatter. Okay, I can definitely relate to this. I have a lot of eye floaters. I've had them for most of my life, and a lot of them do look like gnats. And I've definitely had moments where I thought it was a bug, and then I look, and then I see it jump in my own vision, and then I know it's in my eyeball. So they can definitely be tricky, and I've had patients be tricked by them too, and that's usually a reason that they find them the most annoying and want to get rid of them, but there's not really a great treatment for it. To avoid straining your eyes when you're continuously working, follow the 20-20-20 rule. Yes, the 20-20-20 rule I definitely recommend. After 20 minutes of work, look at something 20 feet away, then spend 20 years in the forest. Wouldn't that be nice? So the first two are right, and the last one is usually for 20 seconds. It's a really good way to give your eyes a break from a lot of screen time and just let your eyes relax the muscles and reset, and it reduces eye strain. It reminds you to blink, so it can help with dry eye. The 20-20-20 rule is an excellent one to follow. As far as running away to the forest is a great place to be for your eyes. Everything's usually a far distance, so the eyes are usually in a relaxed state. Very healthy state of mind for the eye, but not something I think many of us can do. Daddy, look at this picture. Let's see. Oh, and he stretches his arm all the way out the window. Okay, I'm definitely familiar with this. There are a lot of people in my life who are in a bit of denial that they're going to need reading glasses.
Lucy, stop it! Denial is a river in Egypt!
And it looks like this guy needs to increase the prescription in his reading glasses. So maybe try a plus 250. I mean, that might help. Definitely it would help your arm. Still increased, sphere decreased, and patient asks, has it gotten worse then? Optometrist. Oh yeah, this is a tricky one. So the prescription is basically made up of a few numbers. One of them is the sphere, one is the cyl, one is the axis. Some people don't have astigmatism, so they don't have the cylinder and the axis. They just have a spherical prescription. But for people with astigmatism, they have all three numbers, and they just describe the location of each part of the prescription. So the sphere might be in this direction, and then the cylinder is added in this direction, and the axis tells you where the cylinder is located along the circle, basically. And sometimes people can increase in the prescription in one direction and decrease in the other, and it basically ends up averaging out. So that would be a really hard question to answer as a doctor, because your vision could get worse one way and better the other way, and kind of average to the same, but did it get worse or did it get better? Kind of hard to say. When a pediatric patient needs a dilated eye exam and you have to get the whole clinic involved. Oh, it's kind of true. Yeah, sometimes kids are really afraid of eye drops, and there are drops that you can put in before the dilating drops that numb the eye, but the numbing drops also sting really bad. So it's just like, are you going to risk doing a stinging eye drop and then never getting in the dilated drop because they're so freaked out by the first one? This can be a tough situation. It can involve a lot of people, parents, technicians, doctors, a lot of psychology, but it's kind of a lose-lose situation sometimes. Some kids are just really afraid. Yo, people without glasses really just out here seeing for free. Oh yeah. Glasses are so expensive, and it's one of the things that I really dislike the most about healthcare, but the cost of getting lenses made, they have to be marked up a lot in order for the eye practice to stay in business. And the eye practice has to stay in business in order to see patients, and it's just kind of this double-edged sword. There's no winning, and I've always really had trouble with that and felt quite guilty about that, because people need glasses and they can't access them. And there are some insurances that cover them, but not all, so it can be pretty tough. I really wish healthcare came at a lower cost. I'll just put it that way. AREDS 2 vitamins when they find intermediate-sized drusen. Flintstones vitamins with laser vision. Okay, so AREDS 2 vitamins, those are some that your doctor might have recommended to you if you have macular degeneration. They're over the counter, and they help to slow the progression of macular degeneration, or they can in certain cases. And this actually is quite inaccurate. So drusen are what's in the macula that causes the vision to become blurry and slowly deteriorates at the macula, causing you to lose central vision. I wish AREDS 2 worked like this, that they found those drusen and zapped them with a laser, but they really don't work like that. They only help to slow the progression, and it may not work for all people. If they could do this, we'd actually be able to reverse macular degeneration, and that would be amazing. For your next challenge, try to pick which one is more clear, 1 or 2. Oh, okay, so it's from Squid Game. So basically, if you haven't seen Squid Game, it's like a game where they're playing for their life, and it's really disturbing. But if In the eye doctor's chair, when they're flipping those lenses and saying better 1 or 2, sometimes they do look the same. They're like equally terrible. But I would usually try to alleviate my patients' fears and say, you know, if they look equally blurry, just say that. And it helps us to know what the end point is. And a lot of times we can tell how you answer, not just the number that you say, how your vision is doing and what we should do about it. If you don't seem confident in your answer, we'll usually show you the same thing again. If you still don't seem confident, we kind of know we've reached our end point. So you can describe what's going on if you need to. You can say they're equally bad. I really can't choose. And then the doctor will be like, okay, I know what to do with that information. Girl in gym yelling at me to stop staring at her. Me with minus 325 vision in both eyes. And yeah, so this goes again, when you forget your glasses and are looking at somebody, you might be either squinting to try to see clearly, or in this case, just looking in the wrong direction and somebody thinks you're staring. Yeah, try not to forget your glasses with the 325. You shouldn't be driving in that case, but it's a cat, so I don't think he's driving. Send me memes. Have you seen any eye memes that you'd like me to react to? Or seen any posts or videos lately about eye treatments that seem weird or make you skeptical that you'd like me to weigh in on? Send them my way. Thanks for watching, and we'll see you next time.